This brings us now to the topic of wall tension. Wall tension. Wall tension is described by the famous physicist Laplace, who said that tension is proportional to pressure times radius. This is an important relationship. What do we see from this relationship? Tension is therefore proportional to pressure. Tension is therefore proportional to radius. We can also say from this relationship that pressure is inverse to radius. These are some of the derivatives we can have from Laplace's law. Now, let's apply it clinically. Wall tension. From this formula we can see that any vessel that has an increase in radius will definitely have an increase in tension. Any vessel that has an increase in pressure will definitely have an increase in tension. Now, what is wall tension? Think of a balloon. When you blow a balloon up, as you blow that balloon, the balloon expands. The wall of the balloon is under greater tension as the balloon expands. As you increase the radius of that balloon, the wall is under greater wall tension. That is a good analogy to describe wall tension. Notice, the more you increase the radius of the balloon, the greater the wall tension. You keep applying radius, you keep blowing into that balloon, what will happen eventually? It bursts. I'm sure you've done this as a kid. Now the same thing can be applied to the blood vessels. As we increase the radius, we are increasing wall tension. If we keep increasing that radius, what can eventually happen to that vessel? Yes, it may not literally burst, but it can develop an aneurysm, which is like the balloon exploding. And this is why vessels whose pressure and radius are increased far beyond tolerable normal can develop aneurysm. Now, in a normal person, which vessel do you think has the biggest radius in the body? Now, let me pause. I'm asking which vessel and I'm asking radius. Do not confuse radius with cross-sectional area again. So therefore, of all the single vessels in the body, when we compare aorta, a artery, an artery, a capillary, an arteriole, single vessels, which one has the greatest radius? Of course, the aorta. And because the aorta has the greatest radius, according to Laplace, we will expect it to have the greatest wall tension. It also has the greatest pressure in a person who's lying down. So therefore we'll expect, because the aorta receives the full pressure or full force from the left ventricle, we will also expect it to have the greatest wall tension. But the most important factor is the radius, an increase in radius. And this explains to a large extent why, as we increase the radius, we are increasing the tension against the wall. And this is why the aorta predisposes to aneurysm more than any other vessel in the body. Now, as the aneurysm enlarges, what happens to the wall tension? Like the balloon, as we increase the radius, we are going to increase the wall tension. And this is why now the aneurysm can dissect, leading to a dissecting aneurysm. This brings us to the topic of vessel compliance. I hope you are not getting tired and you are still with us. Vessel compliance. This is an important topic. I want you to take a deep breath and let us focus again on vessel compliance. First of all, let us define compliance. What is compliance? Well, the physicist tells us that compliance is change in volume over change in pressure. Change in volume over change. What does that mean? It means that compliance is proportional to change in volume. It means that compliance is inverse to change in pressure. This is what this formula is telling us. Now, change in volume. Compliance is proportional to change in volume. Therefore, compliance is proportional to change. What is change? Change is inverse to elasticity. That brings us to the question, what is elasticity? Now, many people mistakenly think that elasticity is how much you stretch. Not exactly. Elasticity is when you are stretched, how much do you come back? So elasticity is about the recoil, about the coming back. So therefore, elasticity is inverse to compliance. Elasticity is inverse to compliance because compliance is proportional to change, and change is inverse to elasticity. So we can now mathematically deduce that the more elasticity I have, the less compliance I have. Let me give a quick example. If I should ask you to compare the lung of a 60-year-old with the lung of a 1-year-old, which one would you think has the greater compliance? This example is to challenge us to really understand what is compliance, what is elasticity. Now, if you're thinking the 60-year-old, you are correct. Of course, the 60-year-old has more compliance in his lung. Why is that so? Because as you age, elasticity decreases. You lose elasticity in the tissues. And because you lose elasticity, as we said, elasticity is inverse to compliance. If you lose elasticity, then you are going to gain compliance. So this is a concept now. Make sure you remember that elasticity is not necessarily how much you stretch, but how much you come back. This is important when we talk about vessels, when we talk about the lung.